I'm Dr. Laura Finn, and my co-chair is Dr. Melanie Sheen. I'm a benign hematologist, and Dr. Sheen is a breast oncologist. We're both from Ochsner MD Anderson. I've done ASH governmental work with lobbying for American Society of Hematology. Dr. Sheen has done work lobbying with the American Society of Clinical Oncology, so advocacy. And creating this track, which we had the inaugural track last year, and maintaining it has been really important to us. I'm also going to announce that you're going to see me walk out early because in healthcare, work never stops. And I have to take a 4 o'clock meeting, so if you see me exit, there's nothing weird. I'm just doing work on the side while I'm here. So I'm going to chair the first half of the session and Dr. Sheen the second half. All right. So opening our session today is going to be Blood Cancer United. If you aren't aware, this is previously known as our Leukemia and Lymphoma Society. It is, I want to call it an advocacy group that has supported patients, not just with leukemia and lymphoma, but more than 100 types of blood cancers through support of research, through patient needs, and also through their own advocacy. And we have speakers today to talk on a subject that's probably under-discussed. I guess it's sometimes one of those awkward things to talk about, and that is the financial toxicity that can affect all of us, both as providers and as patients in healthcare. Today we have Lauren Edwards and Jennifer Champagne from Blood Cancers United, and we're going to discuss how to protect patients from the harm of medical debt.
Hi there. Thank you so much for having us here, and thanks to Dr. Finn for that introduction. I'm Jennifer Champagne. I am the Grassroots Advocacy Director for Blood Cancer United, covering Louisiana. My role is to interface with our volunteer advocates, to mobilize them, to train them, and to help them share their experiences with lawmakers so that we can drive our policy priorities at Blood Cancer United. And I'll let Lauren introduce herself.
Thanks. I'm Lauren Edwards, Director of State Government Affairs at Blood Cancer United, covering a 10-state region with Jen, and really my job is more in the state houses, direct lobbying, and bringing our patient volunteers, our families, our advocates, and connecting those stories directly with lawmakers in partnership with Jen.
And thank you. So Dr. Finn did a really good job describing our organization. Blood Cancer United was founded over 75 years ago by the de Villiers family after they lost their child, their son, to leukemia. We were first known as the Leukemia Society, and they really focused on research. And since then, over those course of 75 years, we have grown and expanded to include in our mission patient support and then also advocacy. And like Dr. Finn said, you may know us as the Leukemia and Lymphoma Society. Last year we had a name change because we truly wanted to encompass all of the work that we did and give voice to the over 100 different types of blood cancer out there, and make sure that those patients knew that they had a home with us. So we're here to talk about medical debt, and we're here to talk, and of course, in doing that, we need to talk about the cost of cancer care, which you all are well aware is absolutely staggering. The average cost of treating leukemia in the first year is about $500,000, and I will say that stat is probably 3 to 4 years old, so it's easily higher than that now. We also know that after that first 2 years of a diagnosis, 42% of cancer patients exhaust their life savings. That's what that cost does to them. And we also know that because of the costs, even patients with insurance, 4 in 10 patients will delay getting care because those out-of-pocket costs are too high for them to bear. And so, we wanted to dive into this a little bit more and get a better understanding of those costs, of the impacts that they had, and the to our patients, to their quality of life, the quality of care that they had. So we partnered with two of our allies, the American Cancer Society Cancer Action Network and Undue Medical Debt in 2023 to survey adults across the U.S. In focus groups across the U.S. and in a national poll. And we really wanted to create that picture of their experiences and their attitudes around medical debt and these costs. And frankly, the findings were really grim and really sobering. Even before this survey, we knew that there were 100 million patients across the U.S. Dealing with medical debt. And after that survey, 7 in 10 said that they received medical bills that they could not afford to pay. There are people who have made sacrifices in their daily lives that they're unable to sustain that treatment. They self-treated they delayed or skipped care. They changed the foods that they ate. They changed the bills that they paid, delayed paying bills. And of course, 70% of those people say they received a bill that they could not afford to pay. So it's no wonder then that 48% of the people reported being trapped by their medical debt, and almost a quarter said that their medical debt ruined their lives. And these are some quotes from people from that survey directly from them of the impacts that they have faced. They owed money to a clinic that they weren't able to pay. And since this time, we've continued to talk to patients, our patients in various formats across the country about the impacts that they have felt. I've talked to patients who are on Medicare who have multiple issues, multiple medical issues that are rationing their care. They'll decide month to month which provider they'll see because they could only afford to go to one provider that month. They will cut pills in half in order to extend, their prescriptions. We've talked to patients who have had to ask loved ones to help them cover their mortgage because they can't afford it that month. And there's a patient that I've dealt with who, she was a college professor. She did everything right in her life. She depleted her life savings and was living in what she described as a shed in her friend's backyard because that was her only option for a time. So the impacts to these people are just devastating. And then, we know this is from some data from KFF. We know that medical debt hits hardest in different places around the country, and Louisiana is definitely one of those states that is impacted the most. And I think one of the most interesting things out of our survey, did I go too far? There we go. That 84% of the people surveyed said that it was the responsibility of government to come up with a solution on the affordability crisis in care. And I will add that this cut across party lines. It was very bipartisan. You never see that level of agreement on something, so it's really interesting. And so, what are those options? I'm going to turn it over to Lauren so that she can talk about the policies that could be implemented to make some progress in this issue.
Thanks. And so, as Jen said, in that survey, we saw a lot of really grim realities for patients living with medical debt. But the bright spot was, as Jen mentioned, there is bipartisan intention to move forward policies that directly address not only the cost of medical care in general, but also some of the most extreme impacts that patients live with for years after their treatment may conclude. And so at our organization and with partners sort of across the patient advocacy continuum, came up with some policy solutions that really fall into two categories. We want to prevent patients from ever accumulating medical debt in the first place. And that has really been a lot of the bread and butter of our advocacy organizations for a long time. This is advocacy work that is familiar to us. But then really in the past 5 or so years, protecting people that already have medical debt now from some of the worst financial outcomes and some of the worst impacts that may follow them for a long time after they complete their medical treatment that really have severe impacts on their day-to-day financial stability. And we'll talk about upcoming legislation at the state level, which is really exciting, being led by our partners at the American Cancer Society. But just know, this legislation is bipartisan with lawmakers. It's popular with voters and has really seen momentum across the country. In my experience, more momentum in a bipartisan way than so many other policy efforts that our organizations typically take part of. It's really encouraging to see the bipartisan efforts with lawmakers across the country in all corners of the United States. So these are sort of the two buckets that I was talking about. We'll start sort of on the right-hand side of the screen or of the slide. And these are policies that prevent someone from accumulating that medical debt. As I said, these are policies that we've been working on for a very long time, making sure that we expand Medicaid, making sure that patients have access to high-quality health insurance that shields them from really high copays or really high coinsurance, making sure that patients have access to financial assistance programs and policies at hospitals, that they are offered payment plans that they can afford rather than trying to pay a whole bill right up front. So that's sort of the one bucket of preventing medical debt in the future. This sort of newer area is protecting patients that already have medical debt. And that's where the legislation in Louisiana will focus. And these prohibit some of those extraordinary collections practices, not the typical calling you to try to collect on an unpaid bill, but some of those extreme methods that can, as I said, really hurt someone's financial stability. And those include limiting interest rates and late fees, limiting how and when bills are sent to a collection agency, making sure that we exhaust all other options before sending it to a third-party debt collector. And if that bill does make it to a debt collector, putting some guardrails on some of those extreme collections practices, like placing a lien on someone's home or foreclosing on their property, garnishing their wages. And then finally, to prohibit that unpaid medical bill from going on someone's credit report. When medical bills or when really anything hits your credit report, it can take 7 years to fall off. So even if someone has paid off that medical bill, that negative impact could last for a long time and could limit someone from buying their first house, from buying a dishwasher, from getting a car, could follow them for a really, really long time, even after paying off a bill. So I want to invite Alice up from the American Cancer Society to talk about really exciting new legislation in Louisiana in 2026 to address some of these really extraordinary collection practices and how do we protect patients in Louisiana.
Thank you. Hi, my name's Alice Klein, and I am the Louisiana Government Relations Director for the American Cancer Society. So our legislative session just started on March 9th, and in the few months leading up to that, I've been working really closely with Blood Cancers United to figure out how we could bring a policy to help mitigate medical debt in Louisiana. So currently, Louisiana doesn't have any protections specific to medical debt in state statute. So we figured bringing a bill that some of the more low-hanging fruit policies, a policy to just protect the most vulnerable patients from some of the most egregious debt collections actions was a good place to really start and kind of educate lawmakers on the issue and then hopefully build on what we're able to accomplish this year in future years. So this bill, it's actually going to be a late filed bill. It doesn't have a bill number yet, but we're expecting it to post on the state legislative website sometime between now and March 30th. That's the last day that bills can be filed. But this bill would limit the interest rate that can be collected on medical debt. It would also prohibit liens or foreclosures on a patient's primary residence or primary vehicle for medical debt. And then it would protect patients who make at or below 400% of the federal poverty level from having their wages or bank accounts garnished for medical debt. So like Lauren was explaining, this is really just kind of mitigating the impact of medical debt for people who have already incurred it. It will not really prevent them from incurring future debt, but that's kind of something we might want to have a conversation about a little later after lawmakers have had a little more education on the issue. But I also was going to open it up to see if any of y'all had questions about the specific bill or, you know, anything about the state legislative process in Louisiana, and I can see if I can answer that as well. Is there anything else you wanted to add?
Who offered to carry that?
We're working with Senator Talbot, who he's from like Kenner area.
Does it apply to all Louisiana residents, or is it payer-based by their insurance?
So this would apply to everyone. I think the only limit would be that garnishment piece. So that would only protect people who have an income at or below 400% of federal poverty level, as the bill is written right now. But the other provisions would protect anybody. Go ahead.
Since it's sponsored by American Cancer Society, is this focusing mainly on cancer care debt, or?
So no, this would be any kind of debt. Obviously, one reason that medical debt has become such a big issue for our organizations is because medical debt is such a big issue specifically for cancer patients, because the cost of cancer treatment is so expensive, and then it also comes with so many other costs like transportation and travel costs and all of that. But we wanted to make sure that this bill does not, you know, just specifically carve out cancer patients, just because medical debt still is an issue for all sorts of, you know, other diseases and other health problems.
And if I can just add to that, you know, our organizations work closely on so many different issues, and especially on this legislation in Louisiana, but in also other states. But everywhere, I think I can speak for both of our organizations that we've worked on this kind of bill, you know, we're working in coalition with dozens of other organizations, with, you know, sickle cell organizations, and with, you know, JDRF, or, you know, diabetes associations. Or it really is not exclusive to just cancer patients. Patients sort of anytime someone needs ongoing care or expensive care has sort of found a home in advocating for this legislation. And it's been a pleasure to work with advocacy organizations like ours, but for other disease specific groups as well.
Go ahead.
Are there parameters within this bill that identify, and you're saying a lot of different cancers for everybody, but there are people who incur medical debt for non-chronic illnesses or non-illness, like elective surgeries. Do you think the legislature's going to look at this and say, we need to have some borders on this, where it's for illnesses, medical debt related to, specifically for that, and not perhaps non-medical or non-illness type of medical debt, say cosmetic?
Yeah, so the bill as drafted has a stipulation that these protections only apply to medically necessary care and services. Go ahead.
You mentioned that you have bipartisan support in the legislature. Do you anticipate any opposition from any?
We are anticipating some opposition. Most of these policies, from our research, kind of told us that it would be more opposition from the debt collectors specifically, because from what we've gathered, we don't have a ton of data, but from what we've gathered, most of the large hospital systems in Louisiana are not engaging in these types of extraordinary collections actions against patients. I do think it's happening maybe on a smaller, like, anecdotal scale, but it's typically when a hospital has kind of given up on collecting a debt, and they will sell their debt to a debt collector, and then sometimes the debt collectors engage in these types of more extraordinary collections actions. So that is, I think, with bills in other states that have looked similar to this, that is where they've seen most of the opposition come from.
Speaking of other states, are there many other states that have passed similar legislation?
Yes. So the National Consumer Law Center actually has a model policy on medical debt, and it has, I don't know, maybe like 30 best practice provisions. No state has passed that model, but several states have kind of passed pieces of that. I think the states with the most extensive medical debt protections are Maine, California, Arizona, and then Minnesota also has a lot, but there are some other southern or red states that have passed some protections, like Florida, North Carolina, Texas, and Oklahoma all have laws that are specific to protecting patients from medical debt. Go ahead.
The way the bill identifies medical debt, it's covering medical necessary care, is that both inpatient required and outpatient required?
I don't remember off the top of my head exactly how we defined medically necessary. I'm going to need to pull that up, but I think we pulled it from another state, maybe Florida. Do you remember?
It should cover any medically necessary care, whether it's inpatient, outpatient, sort of regardless of where that debt comes from, as long as it's attributed to a medically necessary
Procedure or service, I guess.
encounter.
Yeah.
And typically, I would have to go back and read exactly how we defined it in the bill, but typically it's a pretty broad definition of medical necessity. And sort of one of the things that, we had run into in other states was, well, a nose job isn't medically necessary, but facial reconstruction after a car accident might be. And so we intentionally left it relatively broad so that it could flex to fit individual circumstances.
Go ahead.
So who determines, so is there some type of communications that have to take place to determine the medical necessity? Like, who would that be negotiated with?
Typically, it's how it's billed by the hospital.
Yeah. Y'all had good questions.
Yeah, that's great questions.
Anything you want to add?
Thank you.
All right. Thank y'all so much.
No, thanks for being our guest speaker. Yeah, and so, all of that being said, it takes a lot of work to get legislation passed. I'm sure, as you all know, being involved with this organization, it takes all of us working together to move legislation forward. And so Jen's going to talk about a few ways that you can get involved and sort of bring other folks within your network into our fold to get this across the finish line.
Yeah, as Lauren said, we have tens of thousands of Blood Cancer United advocates across the country that raise their voices, share their experiences in reaching out to lawmakers. They focus on influencing policies, on accelerating research, and ensuring access to care. And we really have an opportunity for everybody to be engaged, whether that's someone who has limited time or energy. They can join us by sending emails and making calls from their home. For providers and physicians, we often call on them to provide expert testimony to be able to explain a very technical issue to lawmakers and educate them. And then we have those groups of individuals who join us in Baton Rouge and join us in Washington, D.C. To really represent the entire blood cancer community to their lawmakers. So in whatever way that might work for you or the people that you work with and influence, we welcome them to our table. You can sign up to be an advocate at the website you see here, and you'll receive emails with information about the policies that we're working on and occasional calls to action when we are trying to move policy. You can join our mobile action team, which is speak to 73727, and you'll receive a very occasional text to do the same thing. And you can also follow us on social media. We have an advocacy page on both X and on Facebook, and really helping us amplify those social media messages is a really great way to to highlight our issues, to gain attention, not just of lawmakers, of the general public, which in turn garners the support of lawmakers. So we welcome you to our table in whatever way you see fit. And if you have any questions for us, feel free to find us. We're around the rest of the day. Thank you.